Good morning, and thank you for joining us. We're here today on Treaty 6 territory, and I'd like to recognize the Métis people of Alberta who share a deep connection with the land. While the UCP's first bill is one to create chaos, conflict, and costs, the Alberta NDP's first bill is Bill 201, the Public Healthcare Delivery Standards Act. This bill will make a real difference in the lives of Albertans who need help when they get sick or injured. I'm presenting this bill because I'm committed to fixing the profound crisis in healthcare that is harming families right across our province. Hundreds of thousands of Albertans can't find a family doctor, which leaves many with nowhere to go but the emergency room. And these emergency rooms are increasingly overwhelmed. We're seeing wait times of 16, 17 hours or more at Children's Hospital, for instance. The Alberta Children's Hospital in Calgary has had to build a temporary trailer in the parking lot to extend the size of the waiting room. Wait times for ambulances have gotten longer and longer and longer. Pressures across the system are causing cancellation in essential surgeries for children. My heart goes out to all Albertans, especially families who've had essential surgeries delayed. So these are the signs of a system that's in deep crisis. And Albertans should be able to expect an ambulance in a matter of minutes, access an emergency room within a few hours, and see their family doctor in a day or two. But that's not happening right now. And the government must be held accountable to fix this problem. Bill 201 compels the establishment of public health delivery standards and then requires the government to be held accountable for delivering on those standards. If passed, this legislation will empower the Health Quality Council of Alberta to create service standards through consultation with patients, service providers, labor groups, post-secondary institutions, and Indigenous communities, to name a few. The bill doesn't limit where health standards should be set, but it does name primary care, emergency medical services, and essential surgeries as needing public delivery standards. If standards are not met, then the government will be required to release an action plan to meet them and must assess if service providers are receiving adequate resources and support from the government. And this is a timely requirement because recently we've seen data from CIHI that projects that UCP spending on healthcare will drop by well over $1 billion this year alone, at a time when healthcare workers are under incredible pressure. Bill 201 makes clear that the government is responsible for supporting frontline healthcare providers in their delivery of quality healthcare to Albertans. Service standards and transparent reporting are a means to holding the government to account for providing these frontline workers with all the resources and support that they need. I know healthcare providers are giving all that they have right now. Now, Bill 201 rests on three principles: that all Albertans must have access to world-class healthcare, that this care is publicly funded, and finally, that this care is publicly delivered. This bill is a necessary first step, and it's a first step to ending the chaos in our hospitals, around our ambulances, and in our clinics. It's designed to eliminate the opportunity for the government of the day to mislead or, frankly, to gaslight Albertans, and instead to establish clear lines of accountability. We are committed to fixing healthcare in Alberta by bringing real resources to the front line and working collaboratively with healthcare professionals. And we will make sure that Alberta families can get the care they need when they need it, close to home. Now, before I take any questions, but speaking of chaos, I am also deeply concerned by the analysis of the Sovereignty Act that the Calgary Chamber of Commerce and the Canadian Association of Petroleum Producers have put out over the past 24 hours. It is clear that business and industry leaders do not want this bill, and in fact, that they, like many other experts who've already weighed in, believe fundamentally that this bill will create uncertainty for investors. the chaos of Danielle Smith's Sovereignty Act will kill jobs, chase away investment, and stifle Alberta's economy at a critical moment. It is so disappointing that so many UCP leadership candidates who were so critical of the Sovereignty Act over the summer now claim that their concerns have somehow been addressed. Clearly, the concerns of Alberta's business and industry leaders have not been addressed. In fact, quite the opposite. And so, it is time for every member of the UCP to discover a backbone and join us in calling for the Sovereignty Act to be withdrawn by the Danielle Smith government. Thank you, and I'm happy to take any questions you might have.
Okay, and we'll start with questions in the room.
Okay, so there's sort of two parts to this bill. There's the reporting aspect, and then there's the part that says addressing the problems must be publicly delivered. I can see how perhaps the UCP would be okay with the first part, reporting requirements, but not the second. Why did you structure these both together in one bill?
Well, I think the addressing the problems, to be clear, there were three components to how the problems should be addressed. That there should be high quality access for all Albertans, that it should be publicly funded, and that it should be publicly delivered. The reason we put that in there, all three of those, is because we know that the research shows us completely clearly that this is the way to most effectively and most cost-effectively ensure that everybody gets these services. And that rather than wasting time playing around with ideological experiments that will prove to be unsuccessful because they have been in almost every other situation, we want to be able to focus on the solution as quickly as possible.
And I'm trying to anticipate what the response might be, and I think one thing they've brought up often is that under the NDP there was some private delivery publicly funded within the healthcare system. So why are you saying now that any solutions must be publicly funded?
Primarily because we don't want to see is the kind of ideas that we're seeing, for instance, with these surgical initiatives, where we set up competing services for what is right now the primary shortage within our healthcare system, which is frontline healthcare professionals. So if you set up two competing groups, then you are going to immediately fragment and create uncertainty and disorganization around the delivery of those services. So that's why in this particular case it just really doesn't work. And quite honestly, in the long term, in most other cases, it doesn't tend to work either. And so certainly when we were in government, we did everything we could to stop the growth of private delivery and to refocus our efforts to the most coordinated delivery we could possibly find.
We'll go to questions on the phone. Just a reminder to press *9 if you're joining us on the phone, raise hand function if you're joining us via Zoom. You could say your name and your outlet at the top. We'll go to our first caller.
Okay, can you hear me?
Go ahead, Dean.
Okay, off-topic question. So the Deputy Premier is sort of arguing with you guys on Twitter. He says that he's making comments about the bill on safeguards that don't appear to be true, saying that any changes from cabinet have to go back to the House, which I don't see in the bill. But he also says there might be some amendments. So what do you think?
Well, first of all, I think the Deputy Premier must truly sit down and read his legislation. You know, it's a very, very short bill. It's not that hard to read. And the Deputy Premier has a legal background, so he should be capable of interpreting the legislation in the way that at this point dozens of external legal experts have interpreted it, which is to say that the Deputy Premier and the Premier's interpretation of the bill is incorrect. So first of all, he needs to acknowledge that what they've been saying up to this point is incorrect. Secondly, though, I don't believe this bill is capable of amendment. I don't think it's capable of being fixed. I think it is so profoundly flawed on so many different levels that it should just be withdrawn.
Okay, thank you. My follow-up then is, but they're, I mean, you saw it yesterday, they're all pretty much, everyone on the UCP front page, anyway, they're all in lockstep. This is, they're saying the bill contains direct legislative oversight safeguards that do not appear in the bill. What is going on here?
Well, listen, I think that the UCP cabinet is very focused on saving jobs. And by that I mean they are very focused on saving their own jobs and only their own jobs. This is a sloppy, risky, chaotic, costly piece of legislation. Business leaders have already weighed in. First Nations leaders have weighed in. Legal experts have weighed in. This bill is a mess. And these cabinet ministers should stand up, grow a backbone, go back to the points that they made a mere 3 or 4 months ago, and act on principle and demand that their premier withdraw this legislation and stop risking Alberta's economic recovery.
Do one more pass for questions on the phone. *9 if you're on the phone. Raise hand function if you're joining us via Zoom. I think we've got one more in person.
So since we're talking Sovereignty Act, in the debates last night, it seemed that the UCP was sort of talking about the preamble, the purpose of the bill to fight back against Ottawa. Your caucus was talking about these clauses, the Section 3 and Section 4. So if it could be amended to alleviate those concerns, but still have a bill that is about standing up for Alberta and its resources, I guess you said you don't think it can be saved, but
I really don't think it can be saved. I mean, if they want to get up in the House and do a ministerial statement about the need to stand up for Alberta and stand up for Alberta's resources, that's great. But the bill itself contains specific clauses which give unprecedented control to the cabinet to go around the legislature of Alberta. It also proposes to engage in activity that would render uncertain a whole swath of laws in Alberta, both provincial laws and federal laws. It also calls into question the rule of law because they purport to have the legislature dominated by a bunch of UCPers who apparently haven't even read their own act to somehow be as capable as the courts of establishing what's constitutional and what's not. So it's just it's a mess. It's a mess. And there's so many different layers of it that generate uncertainty and generate fear on the part of investors that they must pull it back and stop damaging Alberta for the sake of their own self-interested partisan purposes.
And another thing they brought up in the House yesterday is like, hey, the Saskatchewan First Act got support from the Saskatchewan NDP. How come you're not supporting this? So,
the Saskatchewan First Act is a fundamentally different piece of legislation. The Saskatchewan First Act is primarily window dressing, and it doesn't have anywhere near the damaging components to it that this one does. So that's the difference right there. Beyond that, I mean, we will do what we believe is important for Albertans. And what we're hearing from Alberta business leaders, from Alberta leaders in the oil and gas sector in particular, from investors who want to come to Alberta, from venture capitalists who want to invest in Alberta, from First Nations leaders around Alberta, all of them are telling us that this is bad and shouldn't happen. And so we're going to stand up for those folks.
And that's all for today. Thank you very much.
Thank you.